Okay, so we'll turn attention to COVID-related matter. We've got Dr. Mukhtar Mohammed, who is the head of technical secretariat and then is a member of the Presidential Steering Committee on COVID-19, joining us from our studios in Kano. Good morning, and thank you for joining us today on the program. Well, we know the government...
Good morning. Thank you for having me.
Kano happens to be one of the 6 states that they put on red alert, saying several things need to be done to ensure we don't find ourselves with situations that will be very difficult to handle. How is Kano handling that information in the first instance, and what are you doing to ensure that things don't get out of hand?
Yeah, thank you very much. As you will recall, during the beginning of this pandemic last year, Kano suffered one of the most fatalities related to COVID-19. The Kano state government has done a lot in terms of training personnel, in terms of setting up isolation facilities, in terms of setting up rapid response teams, and in terms of rolling out, mitigation and containment measures in the state. So a lot has been done. Kano has had the experience, and Kano has recorded a large number of cases, a large number of mortalities. Also Kano is really one of the states that we have now designated as one of the red alert states. The reason for doing this is because of the recent events that we are noting in the country. We've seen a rising number of cases. We see a rising number of hospital admissions. And we have had a conversation with the state governors and also with some selected states regarding the measures that need to be taken to curtail or to prevent this imminent looming third wave that is hovering all over Africa.
What? Just for the purpose of clarity, Mr. Mohammed, Dr. Mohammed, what does that red alert signify?
It signifies that these are the So it signifies that these are the flash points of the pandemic. If you look at the states, we're talking about Lagos. Lagos has recorded over 60%, of the cases in the country. And even with the third wave, we started to see it rising from Lagos. We're talking about Oyo State. We're talking about FCT. We're talking about Kaduna, Plateau, Rivers, and also Kano. Now, these states constitute more than 92 or 93% of all the cases that we have seen in the country. Mind you, most of these states also have international airports, so they are designated points of entry. You have international passengers or persons of interest that come into the country through these cities. And we know that the third wave is going to be driven, or is currently being driven, by passengers of interest, people who come into the country, probably introducing new strains of the virus into the country. As you are aware, we have recently isolated the Delta variant, and we are taking every step that we deem necessary to prevent the spread, because the Delta variant is it has a faster spread, it transmits more easily, it's more virulent, and it leads to more hospital admissions or hospitalization than the other variant. So that is why these cities are specifically picked up, because if we're able to contain the epidemic in these cities to a great extent, we'll be able to slow down the spread of the virus, or slow down or flatten the curve of the third wave in the country.
I'm wondering what that red alert implies for the people, for the citizens, especially the indigenous, the residents of those particular states, that you have that have already been flagged. That's really what I would love to know.
So that really means a higher level of preparedness and alert on the part of the authorities, for them to be preemptive, to prepare against rapid propagation of the disease, to put on all the containment measures that are already stated in the guideline, to bring up some level of enforcement, and also for them to also sensitize the public so that we reduce congregation, we comply with the non-pharmaceutical interventions that are in place, and we also generally ensure that they are ready to brace up, for any eventuality that will occur. So this is what it means for both the authorities and also for the people in these states.
Well, I'm pretty sure that the Presidential Steering Committee would also have considered the challenge of that delicate balance of lives and livelihood. In what ways do you think this may have been considered, and that people themselves could take responsibility along that line?
So certainly, from the very beginning of the pandemic, we've been very conscious about limiting the livelihoods of people. We saw during the lockdown the impact that had, particularly on people who have to live daily, to make their earnings. And whatever measures we are taking now is to ensure that we maintain this delicate balance between our public health interventions and also the negative socio-economic impact that this will result in. So in doing this, that is why we are narrowing down to selected geographic locations. Right now, what we're doing is to put these states on red alert, meaning that we are going to heighten surveillance activities, we are going to heighten the containment measures, and we are going to heighten our mitigation efforts in these states. But at the same time, all other states also, should be ready and be prepared, and also take the necessary measures that are required to ensure that people remain safe. So in terms of the specific activities that we expect these states to carry on, will include reducing public congregation. Certainly based on the current guideline, there are certain public places that should not be opened at this time. We have also to ensure that people comply to these measures of non-pharmaceutical interventions. So we expect these states to ramp up these efforts to ensure that people wear their masks in public places, to ensure that there is a restriction of gathering, limiting to about 50 people per space, or 50% capacity in terms of religious gatherings. And now with this festivities that are coming up, also, to scale down on the amount of festivities that usually, are carried out.
For a lot of people, the festivities have begun already. I mean, you could judge by the population you see on the roads, in vehicles, and of course, in those places of gathering. To what extent really would enforcement go for this one? Because I mean, it's one thing to give these guidelines, place these states on red alert. I imagine that other states are on amber alert anyway. But it's another thing to ensure that those rules are enforced. And if there's anything we've learned from the enforcement of COVID-19 protocols, it's been quite tricky. Do you have any new ideas, any new plans to at least make this one stronger?
So, as you are aware, enforcement is the function of state governments. We are engaging with the state governors and also with the state authorities to make sure that we comply as much as possible to these guidelines. Just as the point you mentioned, it's not meant to be punitive. It is really meant to protect people more, but also allow people to earn their livelihood. So some of the things that we are going to see in recent times after our conversation with the state governments will include a phased implementation of restriction of movement if these numbers continue to soar. We have outlined the stages that we are going to follow. We will start, with entertainment industry. We'll follow through with public gatherings, such as political rallies, and then we'll come down to maybe more services. We have already identified essential services that as much as possible, this will not be affected by that. But again, each case will be treated as it arises. As I said, the discussion will be with the state authorities to be able to enforce this in a phased manner.
Does this also include targeted lockdowns? Because I saw that on one of the front pages of the dailies. If it does, what set of criteria will be used to enforce this targeted lockdown?
So the criteria will be based on, like I said, the number of cases that we see rising in each of these locations, the amount of non-compliance that is noted, and you remember that all the states already have their task teams, though some of them are not really very active. So it's for them to rejuvenate and to reactivate these task forces, and also to bring out these notices to public places. For example, for the markets, they should enforce no face mask, no entry, for example. If it is getting overcrowded, there will be restriction of the number of people that get into these public places. There may be some amount of reduction in the amount of people that attend offices, just like we had at the federal level, where up till this moment, grade level 12 officers still do not report to offices. So these are the measures that we will discuss with the states, and we'll continue to encourage them to implement. And certainly, they will now be enforced by the state task team to ensure that people comply.
So there's the non-pharmaceutical measures, definitely, and there's a pharmaceutical measure, which is, I think the most prominent is vaccination. And just recently, NAFDAC announced the approval of 2 more vaccines, Moderna and Sputnik V. And, Sputnik V is Russian. And, there's still the process of WHO approving that particular one. We had a conversation last week that talked about, the PSC having, a vaccination pillar within it. So what's the thinking, especially regarding Sputnik V vaccine within the PSC? Because I understand, of course, the MPHCDA is represented there.
So certainly, there are discussions currently going on bilateral between the Federal Ministry of Health, NPHCDA, and also the Russian government. The dossiers have been submitted to NAFDAC, and as you mentioned, it has recently approved the use of this vaccine. And now what is left is just to continue with the negotiation to be able to procure and get these vaccines as fast as possible into the countries. But it's not only Sputnik and Moderna. We're also getting some large doses of the Oxford AstraZeneca. We have been told to expect some doses before the end of July. We're also expecting some doses of Johnson & Johnson, almost about 3.9 million before the end of September as well. But as you know, this vaccine politics and promises have lingered for a long time, and we all know it was because of the huge demand placed on the manufacturers, particularly by the rich and advanced countries, to acquire for their own citizens. We have also heightened our own effort and negotiations in that regard, and we hope that this will soon begin to yield fruit, to be able to get these doses of the vaccines into the country.
Is there any research going on in the States about what's going on with COVID, how to develop our own measures of vaccine? Or is the state even collaborating with any research institutions or agency or anywhere in the country or beyond the country?
Our research institutions have been very active, but as you are aware, we have not reached really that advanced stage where we'll say that we'll start manufacturing our own vaccines. But certainly there are negotiations, there are collaborations going on. The Federal Ministry of Health has assigned some funds into that. We're also collaborating with the private sector. The Honorable Minister of Health has pushed that idea to be able to have this public-private partnership to commence exploring the production of vaccines in the country, not only specific to COVID-19, but all other vaccines. Because as we see now, the future of public health really is in preventing this epidemic. So certainly there are a lot of discussions, negotiations, and efforts that are going on, and these are backed by resources from the federal government.
Some researchers, some in your field, in medical practice, also wonder if there's been any kind of research or feedback from people about the efficacy of the vaccines so that we can know, measure impact, measure effectiveness, and then be able to fast track. Anything about that so far? Because there are concerns that the vaccines were created, because of the first strain of the virus COVID-19, but now that we have this Delta variant, which according to information that you have also given us, is like 100% more virulent than the original strain. So has there been any research conducted or any feedback on the efficacy of the vaccines on the people who have already taken it, and consequently effect on those who may be affected by this new variant?
So efficacy of vaccines is something that continues to be measured, not only in specific locations, but also globally. As more people take the vaccine, whatever type they take, certainly information is collected, and it will be analyzed to see what proportion of the people actually come down with the disease out of the people who have been vaccinated. And that is the information that is required to calculate efficacy. In Nigeria, yes, we have a study protocol that has been proposed and is in its final stage now. Data has already been collected on all people who have been vaccinated, and we'll follow them up to see how many of these people who have been fully vaccinated, who have received either one dose or even the 2 doses of Oxford AstraZeneca and the subsequent vaccines that will be administered, that will now come down clinically with signs and symptoms, of COVID-19, and who will eventually get into admission of COVID-19, because this is the information that when you collect a large quantity, you use it to define the efficacy of vaccines. So like I said, it's not something that is done just locally, but it's something that is done globally. But I'm glad to say that, yes, this study is currently in the pipeline, and the data is already being collected. And when we reach that sufficient quantity to analyze and come out with inference, certainly that will be made public, and it will further buttress the efficacy of the vaccines at the various stages. Thank you.
All right, Dr. Mukhtar Mohammed, Head of Technical Secretariat and member of the Presidential Steering Committee on COVID-19. Thank you for your time today.
Thank you very much.